Welcome to Lotus Health Education and Wellness Empowerment through Health Enlightenment. In some of our recent videos, you've seen that we've been talking a lot about your cardiovascular health and how to keep yourself well and what to interpret from some of the lab results that are often used in order to both recognize as well as track the treatment of people that have really significant cardiovascular issues. A question I get all the time from patients is, I don't want to take the medications, what else can I do? And a lot of times we as healthcare professionals tell you guys, eat healthy and exercise. And I always get the same face from people. Eat healthy, Jennifer? What does that even mean? Oftentimes when we're talking about eating healthy, we're talking about eating foods like these. Healthy things like things containing whole grains, legumes, fresh fruit, particularly berries, fresh greens, sources of healthy fats, things that contain seeds and other ingredients that are healthy for you. And I usually provide this beautiful list for patients. And again, I'll often get a face. Jennifer, I'm really young and I take excellent care of myself. I don't need to do all of that stuff, eating those things that you have there. Not interested. But honestly, while I understand that there may be some very healthy and young people out there that don't feel like eating stuff like this is really necessary for them, the truth of the matter is that it is something that's really important, because in the healthcare field, one of the things that we're finding now is that from a very young age, from the time people are children or even a little older than that, in their adolescence or 20s, we're finding that not eating things that tend to be what's referred to as whole foods, not plugging the supermarket, I'm talking about things that are actual whole ingredients and stuff that you can handle fresh. Not eating that stuff, particularly from a young age, and eating a lot of processed foods with refined sugars, dyes, preservatives, and a lot of other things that have been somehow manipulated, is leading to us finding signs of cardiovascular disease and overall metabolic disorders in general in people from a very young age. In fact, we're finding people from when they're children or in their early teens that are getting diagnosed with things that we normally wouldn't see until somebody was in older times, and by that I mean years ago, in their middle age, 40s, 50s, sometimes in their 60s before we identify. So even though you may think you're young and healthy, not eating healthy foods might actually be a problem for you. So when we talk about eating healthy, why exactly is it helpful? In today's video, we're going to take a look at exactly where some of these food items and substituting them in for other things that you might already be eating can be very beneficial for some of those exact areas that we've looked at recently with the structural changes that are happening to our heart and our surrounding vessels, but also to help adjust some of those numbers that we look at from the lab values like the advanced lipid panel that we've looked at before. We're going to talk today about food, and in subsequent videos, we're going to look at specific supplements and of course the medications that can help to address what's going on with your heart and all of the surrounding areas. Before we go any further, remember to like and subscribe, hit that button down here below the video. That's really helpful for us. And remember to follow us for more great content. And also, I can't carry on the video without saying that while we hope that you find the information in these videos great, beneficial for you as you go on your health journey, make sure that you're always consulting with a licensed professional that's caring for you and knows about the specifics with your health condition so you know what's going on. So let's jump in and take a look at why eating healthy is good for you and your heart. A lot of patients are not comfortable with the idea of using medications to treat the things that are going on with them. And I can completely understand that. As a pharmacist, believe me, I spent years in school and now even more years subsequently as a practicing professional learning about the things that medications can do long term, where you're taking it to treat one thing and then without you realizing it, or sometimes with you realizing it, the medication you're using to treat one issue is helping to create or make worse another issue. So it's completely understandable that there are patients out there that don't want to have to take medications. So the first thing that you can do, which is usually the case with most health conditions, is to start changing how you eat and your activity level, or in certain cases, not eating. So taking a look at the board, one of the things that we looked at in our previous video were some of the changes that were happening at a structural level with our heart, beginning with a lot of that early disease and inflammation. So exactly what was driving that as to why we're seeing it. A lot of times what's causing that are consumption of certain things like trans fats, red meats, engaging in certain types of behavior that can predispose us to issues like consuming a lot of alcohol or smoking, and also not treating high blood pressure. So we talked a little bit about high blood pressure already in our DASH diet video. That diet plan, which is again low salt, pretty minimal dairy, and eating a lot of fresh fruits, vegetables, and in general whole foods and lean meats, can help not only control your blood pressure, but in the case of the issues that we're looking at here, following the DASH diet, which you can find a link to that video below this video, can actually be incredibly beneficial. A lot of the changes that we see in the vessel in that early disease stage can actually be helped if you've got blood pressure issues by trying to keep blood pressure under control. Remember, you're seeing a lot of what's happening here because of damage that's being caused to your vessel. Some of it is by things we're introducing into our bodies from the things that we eat or things that we're exposing ourselves to, but also some of it is being caused by not controlling other health issues. So that's something really important that you can do right away to help what's going on there. As far as some of the things that we're eating and doing to our bodies, some of the easiest changes, as you can see here, is stop smoking. I know that that sounds easier said than done, but there's a big reason why if you see a cardiologist, a lot of cardiologists and the people that work for them have educated themselves on smoking cessation. Smoking is one of the big risk factors that we can see that does things to the structure of your arteries and other surrounding vessels that over time can lead to some serious cardiovascular issues as well as other things. So it's important that if you're a smoker and you know that you have active heart disease or come from a family where there's significant risk, stopping smoking is so incredibly beneficial to your overall long-term survival. Also, alcohol consumption. I know a lot of patients get upset about this because every few years there's new studies. Some of them show that consuming red wine is healthy for you. And then another study will say that beer and hard liquor is bad for you and stop drinking all alcohol. Honestly, at the end of the day, it's an individual thing. Some people can consume a glass or multiple glasses of wine or other types of alcoholic beverages on a daily basis, and little to nothing happens to them. But overall, we talked a little bit in both our regular lipid or basic lipid panel, as well as advanced lipid panel about your triglycerides. The triglycerides are impacted by sugars that we're putting into our bodies, and that includes alcohol. So if you have an issue with triglycerides, and if you think that long-term that could be leading to some of the buildup that you're seeing with the changes here in your heart, you're gonna want to try and back off of any sort of alcohol that you're consuming and try and find that sweet spot where you can have a drink every now and again and socialize and enjoy yourself, but you're not consuming too much alcohol, because having too much, and again, what constitutes too much is sort of up to you and the people that are taking care of you. Having a lot of it on a daily basis especially is gonna lead to some of these changes that we see right here. As far as food items that we're consuming and how they can make changes in order for you to be healthier and minimize a lot of the structural issues with the heart, are going to be things that have refined or processed sugars. So these are going to be things like baked goods that are mass produced, where sugars are added even on top of some of the already sweet ingredients for taste and to make your body crave those items more. Clearly, things like candy are going to be among those items that you're going to want to minimize or discontinue completely if you can from your diet. Sodas, most juices, anything that has added sugars, and especially if those sugars are processed, meaning that they tend to be white sugars or things that have gone through certain treatment processes. Trans fats are another item on the list, which we want to try to minimize as much as possible. This is typically when oil in a liquidy form is transformed into a solid. So things like shortening and margarine, items that include this, which tend to be, again, mass-produced baked goods, fried items. You want to try to minimize the consumption of these items. I know I'm adding a lot of things on this list that most people are not going to be very happy about. But unfortunately, most of these things that a lot of us enjoy on a daily basis really weren't meant to be consumed as often as we tend to eat them here in a lot of Western cultures, and what's becoming a lot more prevalent in cultures in other parts of the world where historically we don't really eat like that. You want to try to substitute with trans fats, healthier sources of fats, consuming things with olive oils and certain other types of healthier fat options, which in our subsequent videos, we're actually going to be looking at things like the Mediterranean diet and diet plans and types of eating patterns that are popular in other areas like the Middle East and Asia, where the types of fats that are being consumed are actually beneficial for the heart as well as other parts of the body. One of the last big changes that we can make in terms of what we're eating regarding the changes here with the heart is also going to be in regards to our omega-6 consumption. Where this is coming from is right there on the list with red meats. We tend to consume a lot of red meat here in Western cultures. And typically, you'll hear about meal plans and things like paleo or keto, things that are based upon eating a lot of proteins. And often it includes, for most people here in the United States and in other parts of the world, consuming a lot of red meat. Red meat can be beneficial in certain ways, but over the last several years, really kind of more decades, we've seen research that suggests that consuming a lot of red meat actually becomes problematic long term. And the reason for this is that balance between the omega fatty acids, specifically omega-6 and omega-3. A lot of people hear fatty acids or omega fatty acids and just assume all of them are good. And in fact, if you ask the average person, even sometimes medical professionals, they think that omega fatty acids are just omega-3s. Omega-3s have health benefits, but there's actually multiple types of fatty acids. And even among that omega family, there's different types of omega fatty acids. Omega-6 tends to be the one that we get most from consuming red meat. Omega-3 comes from consuming certain things like cold water fish, most typically for us, again, here in the Western world, especially in the United States and in certain other parts of Europe, for instance, consuming salmon tends to be among the more popular, though there are other fish, which if you take a look in the description, we've got information for you about different sources of omega-6 and omega-3s. So with consuming omega-3s, they are beneficial, and you want to maintain a balance of the different omega fatty acids. The problem is that the higher you have omega-6 consumption to omega-3, meaning that you're eating a lot more omega-6 and not enough omega-3s, you throw off that balance. And when you do that, what we're finding is that having too much omega-6, which again, you get a lot of when you consume red meats, causes increased risk of inflammation and certain other issues that long term can lead to cardiovascular issues because of the damage that it can cause to your arteries and the other surrounding vessels. So with regards to that, here in the United States, what we've tend to find is that our current ratio of omega-6 to 3 is 10-1. That is a pretty big ratio. In general, and again, this is not prescriptive, so if you have a healthcare team that is comprised of a dietitian or someone with a pretty good nutrition background that advises you on your specific health, sit down and talk to them. Because what we've found is that, as you heard me mention, diets like the Mediterranean diet and diet plans that are coming from consuming foods consistent with certain cultures that contain omega fatty acids, is that when you have a ratio closer to something like 2-1 omega-6 to omega-3, or 4-1 omega-6 to omega-3, or even a 5-1 ratio of 6 to 3. Anytime you have that, you tend to see healthier outcomes in terms of how the person's arteries look, overall numbers, particularly with things like triglycerides. So these are things that we want to be mindful of anytime we are consuming a lot of proteins. If you take a look again in the description below, I give a little bit of information about what happens as your omega-6 values goes up too much and you don't have a good enough balance as you are weighing out the different things that you're eating of omega-3s along with that. So that's your structural changes for your heart. But what about some of those specific numbers that we see associated with your labs, both your basic lipid panel as well as your advanced lipid panel? What can you do to adjust those? So basically, kind of going through some of them, starting off with our basic lipid panel. For your HDL, while there are supplements that can be taken, and cardiologists as well as other healthcare professionals kind of go back and forth on their comfort level of taking those supplements, if your HDL is too low and you'd like to raise it, exercising is one of the easiest things that you can do. Exercise is going to be beneficial for you just in general. Again, helping with your weight maintenance, helping to keep your body moving and keep you in good shape. There are a lot of benefits to exercise. And in terms of your labs specific to your cardiac health, HDL responds by going up the more you exercise. With your triglycerides, we spent a few minutes a while ago talking about one of the things that's very beneficial for triglycerides. Fatty acids, particularly omega-3 for instance, being very healthy. And as mentioned earlier with the alcohol consumption, your triglycerides are responding to the sugars oftentimes that you're consuming, as well as some of the fats that you're eating. But if your triglycerides are a concern, one of the easiest non-medication, non-supplement things that you can do is to eat sources of omega-3s, which again, take a look in our description. We've got some great examples of foods that you can incorporate, or maybe you already eat them and could just eat a little bit more of that can boost your omega content. And then decreasing those sugar sources. Some sugars are going to be very helpful for normal functions in your body, but again, if you're a diabetic and or have some of these cardiac issues that we're looking at here, it's a good idea to keep your sugar content low. Moving on now to our advanced lipid panel. What can we do there? So in terms of your particles, both the particle size and number, one of the things that we were looking at in terms of your diet is fasting. Fasting is an extensive topic, and I can see some of you on the other side of the camera very interested because fasting has become something that's very popular in the last several years. Intermittent fasting, complete fasting, people fast for 24, 36, 48 hours. There are different fasting options. There's a whole other discussion, and by extension, that'll be a whole other video discussing that. But one of the things to know is that in looking at how to address the lipid in terms of the LDL particle size, number, and constitution, fasting is been researched and found to be something that can potentially be beneficial. You need to be careful with it. In terms of this video, all I'll say is that if you're a diabetic or you have certain conditions where you're dependent upon food in order to be able to safely take medications or to do certain other things, you need to think very carefully about fasting to begin with, and then by extension, what type of fasting pattern you use. In terms of some of the other things you can do, again, exercise is going to be a big thing here. Exercise, come up with a routine. Again, take a look at the description. We give some general recommendations in terms of things like the NIH and CDC and what they found is beneficial. As far as the things we can eat, berries are very beneficial. In general, because again, we talked a little bit about the fact that with some of these advanced cardiac issues, you can end up with things like inflammation. Berries contain nutrients and things in them that as your body is processing them, you can help combat some of that inflammation. Strawberries, different types of berries from that family are found to be very good at helping with a lot of those inflammatory processes. Beans, nuts, grains, these are also things that are very beneficial in terms of your LDL and helping to control some of that and decreasing your carbohydrates. If you're going to be including carbohydrates, even in small quantities into your diet, and you're looking to try and adjust your LDL particle constitution, try to lean more towards things that go through the least amount of processing. Brown breads, whole grains, things that are not enriched, refined, or bleached in any way. If you take a look at most of the packages of products that you purchase, you want to take a look at the ingredients area and take a little picture here in your mind of what's happening to these things. It'll tell you oftentimes exactly what process the wheat or the flour, anything like that, had to go through before it became the product that you're about to consume. As we move on now to the next section of our advanced lipid panel, your apolipoprotein B or ApoB. Typically with this, you're going to want to make sure that you try to decrease your fat consumption and exercise. With regards to your apolipoprotein B, try to make sure that you're incorporating some of those healthier fats, things like avocados and certain other sources of healthy fats that might be good for you to have on a daily or several times per week basis, and exercise routine. Typically, when we talk about exercise, which you've heard me mention a bunch of places in this video, it's things that your body can endure. Typically, weight-bearing exercises using machines, maybe certain classes, running or briskly walking. There are different types of exercises that are going to be beneficial depending on certain other health conditions that you have. So again, make sure you talk to your healthcare team and determine what that is, but it can be very beneficial to have an exercise routine in general to help with some of these things and get them under control. In regards to your lipoprotein A or Lp(a), you want to decrease your sugars. We see a very tight association between elevated Lp(a) and having things like diabetes, for instance. So we know that there is a very close correlation between decreasing your sugar and increasing the overall benefits to your health of not having elevated glucose, elevated A1C, and in the case of your lipid panel, bringing down the number for your Lp(a). You also might want to consider consuming fresh fruits and vegetables and also nuts. So in general here, having something that is healthy, whole foods, and decreasing your refined sugars, including certain types of carbohydrates in general, like pastas, breads, things like that, keeping a minimal and introducing more fresh fruits and vegetables is beneficial to your Lp(a) before thinking about introducing medications, which, as we'll take a look at in our future video, there are certain products out there that can also help beyond the exercise and diet to address your Lp(a) and some of these other areas. In regards to your Lp(PLA2), you're going to want to take a look at an option to be able to increase your omega fatty acids, particularly your omega-3s. So again, from the description, some of those items like cold water fish, flaxseed, items that are going to give you a good source of omega-3s can help to address some of the concerns you have with this particular lab value. We also find that there's a correlation, just like we were talking about with the structural changes to your artery, with regards to your blood pressure management. Having good blood pressure management seems to also help as well with this particular value. So try, if you're on blood pressure medication, to stick with it. Take it regularly and monitor your blood pressure to make sure that it's responding properly to the medicine. And also consider things like reducing your salt intake and implementing some of those changes, which again is what makes the DASH diet beneficial for your cardiovascular health in a similar way from a lipid standpoint as it is from a blood pressure standpoint. So those are a few of the things that you can do in terms of diet and exercise to address both the physical changes that we saw, as well as some of your lab-related changes that are happening with regards to elevated cholesterol and different components of your lipid panel. We hope that you enjoyed today's video. Remember to like and subscribe. Follow us for more great content. And if you have any recommendations of topics, we've got some great videos that we're lining up to put out here on the YouTube platform, as well as some additional areas. Go ahead and drop a comment here below the video so that we know some of the great topics that you'd like. We hope that you found it helpful today, as this is always one of the questions we get on where these different healthy food items might fit into your overall health routine. But we're also going to be talking about not only some of the general things, but in our next set of videos, specific diet plans that you can follow, some of which are backed by research that we've found has been very helpful, and also certain things that we can do with supplements and medications in the event that you're not able to get enough of the benefit from eating these foods, or maybe you don't have access to them, but supplements or certain other types of treatments are an option for you. Again, remember to like and subscribe to our content. Thanks so much for coming here and watching our videos on Lotus Health Education and Wellness, and we're gonna help to make you have empowerment through health enlightenment. Take care.